Welcome to Medical Radiography Exam, India's first radiology website. For more about us, search on Google Made Radio Exam. Please like and share our video. Subscribe our channel. Today's topic is scatter radiation, type and reduction of scatter radiation and scatter to primary ratio. Scatter radiation. The National Cancer Institute defines scatter radiation as radiation that spreads out in different directions from a radiation beam when the beam interacts with a substance, such as body tissue. For example, during X-ray mammography, very small amounts of radiation may be scattered to areas away from the breast, such as the head and neck, sternum, and thyroid gland. The energy of scatter radiation is usually much lower than that of the original radiation beam. During most imaging procedures, the patient's body is the item that deflects the radiation and causes it to disperse about the room, which implies that everyone who is close must take protection measures. At Insight Medical Imaging, common diagnostic imaging procedures that generate scatter radiation include CT imaging, fluoroscopy, X-ray, mammography, bone mineral densitometry, and body composition assessment. Types of scatter radiation. There are several forms of scattered radiation. First, backscatter. Second, side scatter. Third, scatter radiation. Backscatter. This type of scatter radiation is created from behind the film and directed back towards the X-ray tube. This is brought on by residual radiation that leaves the body of a patient, bounces off the film, and then travels back to the X-ray tube. Side scatter. The items in the X-ray room emit this kind of radiation. The floors and ceiling, as well as seats and tables. Scatter radiation. While both backscatter and side scatter can colloquially fall under this umbrella term, an exact definition requires X-rays bouncing off a patient's body. Reduction of scatter. There are several ways in which scatter can be reduced. Number 1. Selecting beam parameters carefully. Number 2. The patient's orientation. Number 3. The patient's compression. Number 4. Grids are used. Number 5. Intensifying screen and cassette design. The amount of tissue that can scatter X-ray photons is decreased as the beam is shrunk to the smallest size necessary to cover the area of interest. In addition to improving contrast, a decrease in kVp will also result in less scatter reaching the receptor. Nevertheless, the required patient penetration and, possibly more significantly, an increase in patient dosage as a result of the rise in MAs needed to make up for the decrease in kVp, restrict this reduction. For film, a reduction in voltage of 10 kVp necessitates double the current for the same blackening. The patient's orientation. When there is a significant amount of tissue between the region of interest and the receptor, the effect of scatter will be very detrimental. The primary beam and scatter cannot reach the receptor when the item is in close proximity to it. As the energy of these photons is smaller than that of the photons in the primary beam, the object successfully prevents dispersion. Hence, based on geometric effects, the region of interest should be as near to the receptor as feasible. In actuality, the patient's orientation is often determined by other radiological needs. The patient's compression. This well-known method requires some explanation. It is crucial to understand that scatter would not be decreased by the mechanism a physicist would refer to as compression, such as a piston compressing a volume of gas. Figures will demonstrate that the exact same number of molecules are encountered by the X-ray photons as they go through the gas on the right as they do on the left. As a result, there will be an equal amount of scatter and attenuation. Soft tissue is actually pushed out of the main beam when a patient is compressed, which results in less scattering material being present and better contrast. Grids are used. This is the most efficient way to stop scatter leaving the patient from getting to the film, and it is covered in more detail in the next section. A filtering tool known as an X-ray grid ensures the sharpness of the picture on X-ray film. The majority of the energy that an X-ray machine transmits through an item, especially a body, is absorbed or refracted by the object. Just around 1% of the X-rays burn a picture into the film and travel through the body in a straight path. The picture may be obscured by the deflected X-rays' erratic contact with the film. These arbitrary X-rays are removed by the grid. Intensifying screen and cassette design. In order to prevent X-ray photons from being backscattered from the cassette, it is crucial to remember that some radiation will travel straight through radiographic film. The photoelectric effect will completely absorb all transmitted photons at this moment if the backing of a film cassette is made of a high atomic number metal. Its high Z backing has tended to be lowered or deleted as a result of daylight loading mechanisms and a move towards making cassettes lighter. Nevertheless, because storage phosphor systems are more sensitive to scattered radiation in CR, their cassettes have a LED screen to lessen the effects of backscatter. If the cage of the screen phosphor is located much below the peak photon energy in the appropriate intensity spectrum, the somewhat increased sensitivity of photoluminescent screens to higher energy primary photons may only be of negligible advantage in minimizing the effect of scatter on the film. Scatter to primary ratio. The scatter to primary ratio compares the primary, unscattered radiation transmitted by the object being photographed to the scattered radiation. The scatter to primary ratio therefore gives a clue as to how much undesired dispersed radiation results from a certain imaging examination. For scatter correction processes or factor determination in radiography projections, the scatter to primary ratio, SPR, might be a crucial metric. In this paper, a direct SPR measuring experimental approach based on localized primary modulation is provided. To illustrate the applicability of the suggested approach in computed radiography, the SPR is measured for steel and aluminum step wedges. The scatter to primary ratio increases with number 1 field size, number 2 patient thickness, number 3 increasing applied voltage, kV. Measures to decrease the scatter ratio. Number 1 decreasing field size. Number 2 decreasing kV. Number 3 decreased subject to film distance. Number 4 using a grid. Number 5 air gap. Thank you for watching. Medical Radiography Exam family wishes you and your family happiness and prosperity and healthy life.